Hello and welcome to Fits on the Go blog. My name is Funsho Odunkan. And
Hi, I'm Amber Johnson.
we're here with Dr. Clyde Yancy. Dr. Yancy, thank you for your time. Would you be kind enough to introduce yourself to our viewers?
Yeah, happy to do so. Hi, everybody. Clyde Yancy. I'm Chief of Cardiology at Northwestern University in Chicago, Professor of Medicine there, and happy to work with fellows in training.
Thank you very much for your time. We've been curious. There's a lot happening in the world of heart failure these days. Can you tell us some of the things you feel are game changers and how is the field going to change as regard guidelines?
So, this is really a great conversation to have because we hear the word game changers being used often and it's almost become passe. It's almost just a part of our vernacular. But in truth, there really are some transformative things that are about to happen in heart failure right now. And it's not just the obvious. Yes, we're anticipating the release of a new drug, LCZ696. I believe it will be positively reviewed by the FDA and it will be a clinical reality. But that's not the only thing that's going to change the system. I think what will continue to change heart failure is a continued focus on prevention, using biomarkers much more smartly. I think a continued focus on the transition of care, keeping people out of the hospital. I think that will make a difference. We're still beating the drum saying it's all about adherence. The more we can get patients to be on the right drugs for the right indication at the right time, the more we can expect them to do better. I really believe that we're on the cusp of being able to take the notion of failure out of the overall concept of heart failure. We have ongoing challenges, yes, like heart failure with preserved ejection fraction, but I think the outcomes are much, much better now than they've ever been, and the opportunity for them to be even better is right within our grasp. So I'm about the business now of trying to take the failure out of heart failure.
Fascinating. Speaking about heart failure with preserved ejection fraction, what do you think are some of the challenges? We had the TopCat trial, which was initially dubbed a negative trial, but then post-hoc analysis suggested that maybe the response was different in Americas than in Europe. What are your thoughts on that?
So I really think that the whole experience with heart failure with preserved ejection fraction really endorses the importance of science. The reason why we haven't moved as far forward as we should is that we still don't fully understand the syndrome, and I do think it needs to be referred to as a syndrome because it's not just one disease. And I think as we begin to understand better the different iterations of heart failure with preserved ejection fraction and the biology behind those iterations, then I'm confident that we can start to use therapies, novel therapies in a very different way and start to realize an improvement in outcomes. But I think especially for heart failure with preserved ejection fraction, the true focus needs to be on prevention. It's so evident that it resides with obesity and hypertension and renal disease and atrial fibrillation that there's some signal that goes awry and leads to the entire syndrome. If we can get to that signal and prevent the condition, I think we have a much, much better opportunity. So yes, TopCat was educational, it was informative. I don't necessarily think it was negative, but the right response isn't to immediately do another TopCat. It's to re-educate ourselves once again about what is it that we are addressing and is there a better way to do it. Science really needs to lead the way as we go forward.